Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. If you're just tuning in, tonight's topic is asthma and bronchitis. Here to answer some of your questions is ExpressCare's Dr. Jitka Lom. So, Doc, if people develop bronchitis, how can it be treated?
Well, they would come into the clinic complaining of cough and phlegm, sometimes with fever. So depending on the age group and so on, sometimes you just have viral bronchitis. This is so common. Somebody comes in, they really don't have a fever, they're just coughing, they're coughing up phlegm, you can hear a little bit of stuff in their chest. It's like a chest cold. It's going to go away by itself. So this is a message I want to put out there, is that most bronchitis in young, healthy people does not need antibiotics. In fact, national guidelines say please don't give antibiotics. Tell the patient to be very patient for about a month before all that settles down. You can use warm water with lemon and honey. It's just as good as over-the-counter cough syrups most of the time. There are prescription medicines that are stronger. We can do that. But basically, it's waiting for that bronchitis to settle down on its own. Now, if you're a smoker, or you're older, or you're diabetic, or you have some other health problem, you may need antibiotics, especially if you have a high fever. So in that case, we would treat with antibiotics. For the chronic bronchitis, meaning somebody who is a smoker, and they're not sick, they just started suddenly coughing up more, their phlegm is worse, they feel short of breath. For those people, we treat them with steroid medication, either orally or also in an inhaled form.
Okay, so I know that smoking really contributes to bronchitis. What if you're a chronic smoker but you stop smoking? Will that help with the disease?
It sure will. So it's never too late to quit smoking. We have the Great American Smoke Out coming up really soon. So commit to your lung health, your overall health. You can do this, quit smoking, because if you do, you are going to get sick less. Now, a lot of times when people quit smoking, for the first month or two, they cough more, because before that, the nicotine kind of suppresses the cough. So for the first month or two, you may be coughing more. But after that, you will start to feel better, your breathing will be easier, and you'll get sick a lot less. And over time, depending how long you've been smoking, but if you've been, let's say, smoking for, let's say, about 10 years, after about 8 years, that lung disease has very much reversed, and you're maybe not perfect, but you're a lot healthier than you would have been if you'd kept smoking. So that's a really big message for me to you today, is to please decide to quit.
Okay, so bronchitis seems to come with a lot of coughing. Is it contagious at all?
It is contagious, especially viral bronchitis. It's contagious. So a whole family might get it. You'll hear it. One kid starts coughing, the next kid starts coughing. Now mom and dad, everybody's coughing, and it goes on for weeks and weeks, and everybody's really unhappy. So if you're coughing, remember, cover your mouth when you cough, wash your hands, don't share your towels, don't share your food, and that will help a lot. And if your child is coughing a lot, really try to keep them home from school.
Okay, so Jose from Inarajan is asking, my asthma worsens every time I take my pain medication. He's asking why.
Interesting. Well, remembering that asthma is part of the allergy sort of pathway for some people, meaning they'll get, again, hay fever, hives, asthma, allergies, runny nose. Some people just sort of have all that. And a trigger for that can be medication. Certain medications can trigger an allergic reaction. You may not have hives, but you may get wheezing. A classic for this is beta blockers. They're a blood pressure medicine. One name is atenolol or metoprolol. When you hear the lol, that is a medicine that's used for blood pressure. And in some people who are prone to asthma, it will trigger it off, and you'll start getting wheezing or a cough. So it's possible that medicine is triggering your asthma. Another one, if I can mention, that can trigger asthma is heartburn, or GERD. We call it gastroesophageal reflux disease, meaning your acid contents are coming up there. And they come up so far up the throat and into the back, down the wrong way into the trachea, that they'll tickle your airways and you'll start getting asthma. So one other reason for wheezing is if you have a lot of heartburn.
Okay, so Shalani from Dedido is asking, can asthma drugs affect my baby if I'm pregnant?
Oh, that's a super question. It's really important that if you're pregnant and you have asthma, you control your asthma really well. Because remember, this is all about oxygen. You need the oxygen to help you grow a healthy baby. So don't be afraid that the asthma medicine is hurting your baby. Studies have been done. It's much more important to help the mom be a healthy mom, oxygenate her body so the baby can get enough oxygen. The steroids will not hurt the baby. The albuterol will not hurt the baby. Even if the mother actually, you know, if somebody has really severe asthma, first we try the inhalers and the nebulizer and all that. But if it's really bad, then they need steroids to calm down the lungs, to reduce the inflammation. In that case, it does affect the child, but it will not hurt the child. In fact, usually it helps the child's lungs mature more quickly. So it's not harmful to the baby, and do take your medicine.
Okay, Peter from Malolo is asking, can a proper diet prevent asthma attacks?
A proper diet will help you in every way. Okay, lots of green vegetables. One natural medicine that will really help asthma is magnesium. Magnesium is found in green leafy vegetables, or in a bottle that you can buy in the vitamin store. 250 milligrams of magnesium is a great muscle relaxer. Now, remembering that these airways are twitchy, they have muscles. These tiny little airways have muscles around that will clamp down. And you can relax those muscles by taking magnesium, 250 milligrams. Easily harmless and a nice way to help you with your asthma.
All right, thanks so much, Doc, for all
You're
that
welcome.
information. We'll be back to wrap